The opioid problem has reached epidemic levels nationwide, and we have seen the impact in Western Washington. And while it is a complex crisis, one area of focus right now is on the medical community's role in prescribing the drugs.
We are seeing, at least in the postoperative period, fewer pills actually prescribed, and which again limits the intensity of exposure to the drug, because it is becoming clear that the intensity of that initial exposure can be a risk factor for progressing to longer-term use.
Dr. Hooten with the Mayo Clinic says when prescribing opioids, pain management has to be the ultimate goal, not pain elimination, and that is such an important distinction. He also says personal history of substance abuse has to be considered.
Using opioids even in the postoperative period for individuals that have addiction is very controversial, and when administered in that setting, they need to be very carefully monitored and managed to ensure that opioid use does not progress.
If risk factors are taken into account, Dr. Hooten says there are times when opioids are safe, for instance, after a surgery. However, he says if someone is concerned about addition of opioids and they are looking for another option, there is a local anesthesia that is good after an operation that would avoid someone having to take an opioid. It's also important to remember a past history of substance abuse is not the only risk factor when taking opioids. Stress level, environment, even genetic makeup should be considered when prescribing these types of drugs. If you would like to see more of our Healthy Living segments, you can go to Q13fox.com/healthyliving.